Hello, everyone. Today we had to start with little bit delay. We had some technical issue, but right now we are live with Dr. Shadi Vahdat, and I love her topic, reversing autoimmunity. I know a lot of people, especially in fertility, they have these disease. We're going to dig into it and talk about it. Dr. Shadi Vahdat is a chief medical officer of Create Cures Foundation, board certified in internal and functional medicine. I'm so happy to have you today. Thank you for joining us. Sorry, hang on.
Oh.
Yes.
Thank you. Thank you for having me, and I'm glad we figured out the technical difficulties.
Yes, finally. It happens. At least we didn't have to terminate it because we still had time. All right. I know these days a lot of people asking me about autoimmunity. And when you talk about your topic, I was so excited to have you today. First, talk about yourself. How did you end up to be functional medicine aside from your medical certification? Degree.
Well, my personal autoimmunity diagnosis had a lot to do with why I even went into integrative medicine and functional medicine. So it's a big, it was, I had no choice but to learn more about it. And I started out about a little over 20 years ago when I got my training. I was, went through medical school and was trained as a conventional medical doctor, where there was really little to no training on lifestyle and nutrition and things of that sort. And so I practiced hospital medicine actually for the first 10 years. And I started, there were points in my life that, especially points where there was a lot of stress, where I had sort of a non-specific symptoms. And I know later we will talk about the challenges with diagnosing autoimmune conditions, but they were sort of bizarre things that nobody could figure out. And, you'd see a doctor, and I'd see, regular doctors and neurologists, and nobody knew what I had. And so these things kind of popped up intermittently, in internship or the first, when I just got a job. So going into around 10 years ago, I started sort of having a lot of these weird sort of numbness, tingling, fatigue, joint pain kind of issues again, and yet again, sort of a battery of doctors and seeing various people. Lots of tests were done, lots of MRIs were done, and basically the only thing that ended up being abnormal was a test called an ANA, which is sort of a non-specific marker that shows that you have an autoimmune condition. Your immune system is attacking self-tissue. And at that point, if that marker is abnormal, usually you're referred to a rheumatologist, and a number of other tests are done looking for rheumatoid factor, rheumatoid arthritis, lupus, Sjogren's, various other things. And none of those tests were positive. So I was diagnosed as having undifferentiated connective tissue disease. There was, I saw a lot of different rheumatologists, and I got everything from, take a yoga class, there's nothing wrong with you, we'll check your labs next year, to one of the doctors wanted to put me on immunosuppressive medication and thought, that would be the best choice for me. And this was a very, the physician that I saw was a very reputable, doctor who'd written the textbook on autoimmune diseases. And when she wanted to put me on steroids and immunosuppressive medication, it didn't feel right to me. And so that's what began the journey into learning other modalities. I trained in acupuncture first, and then later went into functional medicine. And functional medicine, there's a lot of overlap with traditional Chinese medicine and functional medicine, but having the body systems be connected, looking at the whole in a way that sort of a conventionally trained physician could understand, because it's based on pathophysiology and evidence-based medicine. it really sat well with me, and sort of that's I started getting to work on myself, changed diet. Stress has always been a big issue, as it is with most autoimmune patients. So that's a work in progress and something that I have to pay attention to all the time. But that's where it all started. Yeah.
You know, it's so interesting. These days, I'm talking with so many people. Every day, almost every day, I have interviews with doctors, and most of them recommend functional medicine. And not only functional medicine, but acupuncture, holistic medicine. Because before, even myself, I had a journey of fertility issue, and that was the point when I was diagnosed with unexplained infertility. That's the same point that everybody try to seek for answers, why there is no explanation for my problem. And at that point, I knew that there should be something that helped me to at least answer my problem. And then I went to traditional Chinese medicine and acupuncture. And after 1 month, less than 2 months actually, I got pregnant after a few years of struggling. And I know even for fun, I talked to another medical doctor. He was in he was brain specialist, and he did the same thing. He actually had some issues, and then for his patients, actually, he found out about the functional medicine. So how long after you recognize that functional medicine is your path? Actually, I'm not saying that medical doctors and medicine is not good, but I'm saying that they should be completing each other.
Exactly.
Because what I see, there is medical doctors really work hard, but as you see, the nutrition part and lifestyle is something that you need to work on yourself as well. It's not something that medical doctors, maybe they give you some general things about how to eat, how not to eat. So what was different when you realize about the functional medicine? I mean, when you found functional medicine with your patient right now, what do you do different now?
Yeah, I think as you probably know, when you see regular physicians, first of all, there's limited training in nutrition, like I mentioned. So that doesn't really come up as playing a role. That's a huge part of a foundational part of what you address in functional medicine. So that's all additional training. But furthermore, in if you're trained in a regular medical school, a lot of the organs of the bodies are almost like it's like they're separate, they're siloed into separate things. So meaning, you go to a cardiologist for your heart problem, you go to a fertility doctor and the focus is just on, your fertility related organs, you go to a psychologist or psychiatrist for your brain. That is not the approach, whether you're talking about traditional Chinese medicine and functional medicine. All systems are connected, and that's that is makes common sense to most people. So that interconnectedness of the systems and looking at the whole, mind, body, spirituality, all of that plays such a huge role, which is sort of under-recognized or not recognized at all, I think, in conventional training. So what is different is that it's almost, I say this many times, I always say I might as well not have gone to medical school at all, because it's like I learned everything all over again. And so I didn't understand, the importance of looking at food, and food, not only quality of food, but food allergens, and why in an autoimmune patient, your gut health and your gastrointestinal health plays such an important part with your immune system. What goes through your gut, meaning any foods that you're reacting to, any toxins in the food, anything, any imbalance in the gut microbiome, all of these, any medications that are going to disturb and injure the gastrointestinal, permeability or membrane, all of these things are very relevant because we know 60 to 70% of the immune system is our gut lining is lined by our immune system. So whatever's going through the lumen of your gut, it's going to impact or, either activate the immune system or look like, have a calming effect. So I started a lot of the training in functional medicine has you look at these foundational things, how you're eating, avoiding food allergies or food sensitivities, looking at gut microbiome, if there's overgrowth of bacteria or overgrowth of, whether it's parasites or fungal overgrowth, treating those, cleaning the gut, and sort of improving what is called intestinal permeability or leaky gut. These are all very critical. Sometimes in some autoimmune patients, it's a toxin. It might be heavy metals, it might be mold, it might be other things that are bogging down the system. And if you're not improving things with food and diet, and basic things, which I kind of clump into lifestyle, meaning your stress management and your sleep, you need to kind of dig deeper to see why else is the immune system reacting poorly.
What I realize right now from your words, when you go to functional medicine and you are a medical doctor, you go more deeply into the whole body system. And it's not only the symptom, you go to root cause and you say, okay, she has fertility issues, for example, but she may have some gut issue. Let's just check that one too. So you go to whole system, and that's the great part of what you're doing right now. So let's just have some example. I know I have some people complaining about Hashimoto. And I know there are a lot of questions. If you can specifically talk about this disease. First, talk about autoimmune disease, the definition of autoimmune disease, and then go to Hashimoto, please.
Yeah, autoimmunity is essentially your immune system is attacking self tissue, and essentially the body and the immune system is made in such a way that it recognizes foreign pathogens, foreign bacteria, and it should recognize that what is foreign to the body, so it knows to attack it, and it should not attack self tissue. When that process becomes dysregulated and the immune system gets confused, sometimes in an attempt to fight a bacteria. So you get a virus, or you get, as we've heard now with COVID, your body tries to fight the virus, but in that process, stimulates the immune system, and there's similar proteins in other parts of the body that may be similar maybe to that virus. And in that confusion, it starts attacking self tissue. So in a disease like Hashimoto's, which is quite common, especially in women, that attack of the immune system is on your own thyroid. And so there's different types of antibodies. Luckily, Hashimoto's, I think, is one of the nicest autoimmune conditions because it's nice to be able to actually track the antibodies. So there's on blood testing, a lot of people have thyroid. Well, actually, it's the condition that I see the most in my practice. I don't know, maybe 60% of my patients have Hashimoto's. Many of them know they have Hashimoto's, and other ones don't. They may be coming with hair loss, fatigue, brain fog, infertility, irregular periods, cold hands, cold feet, and when we do the test, their doctor has done the typical test, which is TSH, thyroid stimulating hormone. So they've had that measured, it's within range, and that's it. You're told that you don't have a thyroid problem. But my it's pretty much a universal screening for everybody because most of my patients come in with fatigue and hair loss and all those symptoms. I screen for Hashimoto's. I order both antibodies. One is called a TPO antibody. One is the thyroglobulin antibodies. And both of those are consistent in Hashimoto's, which is typically a hypothyroid or underactive thyroid. And so I'm looking for those. The reason I say that it's nice is that, before I started working, and applying functional medicine, I was never tracking these antibodies. And what I find is it's one of those conditions which I think predictably and sometimes easier than other autoimmune conditions, you actually do see an improvement in antibody levels. So it's nice because in conventional endocrinology, people don't care. If you have positive antibodies, that's it. Nobody's measuring it ever again because nobody knows what to do with that antibody. Once you're positive, you're positive. But I'm actually doing things to calm down the immune system. So I'm working on the gut, I'm removing the food allergens, and I'm tracking. And it's one of those conditions that if you're having success, you will see antibody levels come down. You will see a lower need for thyroid medication. Now, obviously, if someone's been under attack of their thyroid for 20 years, that's different. And they may have a lot of damage. They may never be able to go off medication. But a patient that's at an earlier stage might be able to come off. So it's one of those conditions that I think is kind of, really responds well to our interventions.
That was beautiful. Like, you actually mentioned so many great things. I'm just trying to track in my mind because the problem with autoimmunity disease is that the symptoms are mistaken with other disease.
Right.
And that's the problem. And then when you dig into it with the whole body system, then you can find exactly what was the root cause of that issue.
Yeah, it's, I think, functional medicine practitioners are well trained in sort of finding what we call zebras in medicine, really sort of things that the average person does not think about. And strange parasites and viruses and infections and toxins. But I think, I always think the basics go a long way. And if I see an autoimmune patient, one of the simplest things you can do is to eliminate potentially foods that you may be potentially sensitive to. And most, at least in my experience, most autoimmune patients come in with a big list of problems. They may come in with arthritis and aches and pains and joint pain and hair loss and bad sleep and just a lot of bloating and rashes and hives. So they come in with a long list. And I think the easiest thing that you can do without even seeing a doctor or paying a functional medicine doctor, which is oftentimes, a pricey endeavor, then you can easily go on and eliminate common foods that could be potentially a problem. And so I have different types of elimination diets, but in the most basic, you can try to avoid gluten, dairy, corn, and soy. And there's reasons for that. But a lot of times when you do these simple eliminations, you see a number of things improve, and maybe not 100%, but you're at least removing the food sensitivity element. And all of those foods that I mentioned can be potentially inflammatory, and if they're GMO or if they come with pesticides and glyphosate and various other things, they're going to create a problem with gut inflammation and then immune activation.
So can you give us some example of these foods, like specific foods that you're talking about?
The foods to avoid, you mean?
Yes.
Well, I think it kind of, having people eliminate foods is not an easy thing to suggest. Now, the patients that I see are they know about functional medicine. They've already cut out a lot of things on their own. I actually don't get any patients that are out eating at restaurants and picking up hamburger at McDonald's. Like that is not the typical patient that I see. They've already done a lot of eliminations. It's more typical for me to see people who say, "Oh, I've only tolerated 4 foods in the last 5 years. Can you try to help me, diversify my diet more?" But it's a negotiation, and it's what the patient is willing to do. I think that, Some people are all or nothing, so they are open to more extreme eliminations. The autoimmune diet, the AIP diet, or the paleo diet pulls out a lot of potential food allergens, which is sort of what I used to do quite a lot when I started out. I would eliminate not only wheat, dairy, corn, soy, egg, grains, legumes, a lot of things, and have people mostly on an AIP or paleo diet. And you can, it's just, again, it kind of depends on personalizing. I think you can start with some type of a diet. Ultimately, you never want people to be on these extreme diets for long periods of time, because there's great value in all of the foods that's out there. Beans have a lot of great nutritional value. Having a high protein, paleo, high red meat, I mean, that is not healthy for longevity purposes either. So ultimately, you kind of ideally, you would do testing to see what the person is reacting to. So I do food allergy testing. It gets a little bit more in the gray zone when you're talking about food sensitivity, but if the patient can't afford that, then I say at least try to get off gluten and dairy. Let's give that a try for somewhere between 3 weeks to 3 months and see how you do. If you tell me your joint pain and your bloating and your bowel movements and all of that is better, then we know there's some impact from food. And so then we add those in, and try to get the foods back in. Did that make sense?
Yes, of course, because even if for my own practice, I'm doing fertility coaching, I customize everybody's food, because based on the assessment, you will see everybody has her own story, and you don't know, like sometimes some foods are good for people, but they have the same sickness, but you cannot customize food, generalize food for both of them. You have to customize it.
Exactly.
Yeah, exactly.
Yeah, I think more recently also, with my work with Create Cures Foundation, I've added a new great tool to my toolbox, shall we say. In addition to personalizing the diet, what our expertise is implementing fasting, of various different kinds of fasting. And the longer fasts actually have shown really excellent preclinical results in various autoimmune models. So inflammatory bowel disease, MS, and we're trying to do more. So when you're fasting, it actually has a lot of benefits to reset the immune system and help with the gut microbiome. So I find people who have terrible autoimmunity and they do, fasting or fasting mimicking diets and actually get off a lot of medication. So that's another excellent option as well.
That's great. It looks like detoxification, right? So that's what you do for a short period of time first, and then they go back normally to whenever or their symptoms is gone. So I see your website there, clinic.createcures.org. Please let me know what kind of programs you have. You talk about it a little bit, but do you do, talk about it.
So, I had my own, I've been in practice for over 20 years, and certainly I still see patients in the hospital part-time. And then I had my own practice doing functional medicine, seeing a lot of people with chronic complex conditions. And with my work with Create Cures, we're implementing the work of our founder, Professor Walter Longo, who's done a lot of studies on fasting and fasting mimicking diets. And essentially what I do now at the clinic is combine the research that he has done, and with a lot of the emphasis being on nutrition and fasting, and combine that with functional medicine, which is, I think, a great marriage of two very powerful modalities, because I evaluate patients to see if they're appropriate for fasting. I look at gut microbiome. So everything that I was doing in my own practice, looking at stool, looking at, hormone levels, doing the deep dive to look for toxins. I still am able to do that, but also with the tools and what we've learned from the studies of our founder. So if we actually are located in Los Angeles and Santa Monica, California, we do offer telemedicine to people all over the U.S. And actually our dietitian does do consultation for international patients as well.
Yeah, that's what I was going to ask you. That's great, because these days it's so difficult to find somebody like functional medicine in the office.
And we take insurance.
Yeah.
Which is almost unheard of in the U.S. in functional medicine practitioners.
Yeah, interesting. All right. Do you have any recommendation for people who have weird symptoms like fatigue, hair loss, and what do you like? I know for a lot of people they have chronic disease for years,
Right.
and they only go to medication, and this is going to be repeating for years, and they don't have any permanent uh, release from this disease. What do you recommend them?
Well, I think, people can have chronic debilitating conditions, but it's hard to know if it's a simple solution or if it's more involved. And I think that my suggestion would be, if you're having, and a lot of people kind of get used to things, I can't tell you how many people I see that say, oh, I have bloating, but that happens to everybody, right? Or I have fatigue, but, I'm getting older, and they're in their 40s. I have patients who tell me this. They're in their late 30s. They say, oh, it's probably age. Well, no, you should not be tired in your late 30s. So I think if you know, and this is the type of patient that I see, if you know that things are not right, whether it's a little bit of bloating or a little bit of joint pain, that's your body telling you something is off. And I think you have to kind of understand that when you're seeing your regular primary care doctor or general practitioner, they are trained in a particular way. I always say we need all different kinds of doctors. We need acupuncturists, we need naturopathic doctors, we need energy healers, we need everybody. We need the emergency room doctor, we need the surgeons. You just need to have correct expectations of what their training is and what you expect to get. So a traditional doctor is going to be excellent at looking at things that are going to be dangerous or kill you, or fix a broken bone or do surgery, and that's really important. But their evaluation may miss something that's subclinical or milder, and you have to kind of understand that, okay, for that kind of stuff, they're going to rule out that I don't have cancer, that I don't have something horrible. But okay, that's good. That's reassuring. Let's go to the next type of doctor who may be able to help me. Is that going to be a functional doctor? Is that going to be a naturopathic doctor? Is that going to be, a nutritionist? So I would say, don't give up. If you're having, especially, thyroid for women is super common, super, super, super common. And if you're having a hair loss, fatigue, constipation, aches and pains that are unexplained, you feel cold all the time, know that there's probably something wrong with your thyroid. And even if the doctor says it's fine, it's probably not fine, because you're getting a limited evaluation. In the very least, ask for them to run thyroid antibodies and make sure that you are not having an autoimmune process. And then, functional medicine doctors are hard to find, but, there's lots of information. A lot of great colleagues have put great books out there. Mark Hyman, and I mean, there's a wealth of information online, and you can start working with practitioners who can help get the specifics.
Yeah, these are very resourceful information, because I know people have these problems for years, and they even are not aware of, because they think that they only need some medication. But as you say, you are right. They have to go to right specialists. there are lots of information out there which are not really valid, and are not all the specialists in even in holistic medicine are eligible to do this. So they have to check for a specialist. Are they really trained? Are they really eligible to do this kind of assessment or not? And these days, life has been changed a lot, and we know that every parcel of our body is related to another one. So you cannot separate them from each other. If you have gut issue, a lot of people have gut issue, then they have headache. Why they have headache? Because they are related. Every piece of the body related to each other. I'm really happy to have you here. Thank you so much for giving us such beautiful information about the body and a lot of hope to us.
Don't give up. Keep that's the one thing that I want to leave your listeners with, is that if you don't feel something is right, there's probably some more digging that's involved, and it's not in your head, and you probably don't need an antidepressant. There's probably some other root cause.
Exactly. Thank you so much. Thank you.
Thank you for your time.
Bye.